Welcome to Aging Gracefully, your go-to channel for health tips, nutrition advice, and smart aging strategies.
As we age, our bodies become more sensitive to certain foods that were once harmless. Some common items found in everyday diets can pose serious health risks for seniors, leading to issues like high blood pressure, heart disease, digestive problems, and weakened immunity. Foods like grapefruit can dangerously interact with medications, while deli meats and processed foods are packed with sodium and preservatives that can strain the heart. Raw sprouts and soft cheeses carry harmful bacteria that can cause foodborne illnesses, which are harder for seniors to fight off. Additionally, canned foods and fried, fatty meals contribute to hypertension and cholesterol buildup, increasing the risk of strokes and heart disease. Even seemingly harmless foods like raw eggs can contain dangerous bacteria, while sugary drinks and sweets raise the chances of diabetes and energy crashes. Alcohol can interfere with medications and impair balance, making falls more likely, and caffeine can cause dehydration and sleep disturbances. While these foods can be tempting, being mindful of their risks and choosing healthier alternatives can go a long way in protecting senior health. Making small dietary changes can help seniors stay strong, active, and feeling their best. Grapefruit is a healthy fruit rich in vitamins and antioxidants, but it can be dangerous for seniors who take certain medications. This fruit contains compounds that interfere with enzymes in the liver responsible for breaking down drugs. As a result, medications can become too potent or less effective. Some of the most commonly affected drugs include blood pressure medications, cholesterol-lowering statins, and certain anxiety or depression medications. This interaction can lead to dangerously low blood pressure, muscle damage, irregular heartbeats, or excessive sedation. Even small amounts of grapefruit can trigger these effects, so it's important for seniors to check with their doctors before consuming it. If grapefruit needs to be avoided, safer alternatives like oranges or apples can provide similar nutritional benefits without the risks. Deli meats, bacon, hot dogs, and sausages are convenient and tasty, but they contain high levels of sodium, nitrates, and preservatives that can negatively impact senior health. Excess sodium intake contributes to high blood pressure, which increases the risk of strokes, heart disease, and kidney problems. Nitrates and preservatives in these meats have also been linked to an increased risk of cancer and digestive issues. Furthermore, processed meats can be tough to digest and may lead to bloating and discomfort. For seniors looking to maintain heart health, replacing processed meats with fresh, lean proteins like grilled chicken, turkey, or plant-based proteins like beans and lentils can be a much healthier option. If deli meat must be consumed, choosing low-sodium, nitrate-free options and pairing them with fiber-rich vegetables can help mitigate some of the risks. While raw sprouts like alfalfa, mung bean, and clover sprouts are often marketed as health foods, they can carry harmful bacteria such as Salmonella, E. coli, and Listeria. These bacteria thrive in the warm, humid conditions in which sprouts grow, making them a frequent cause of foodborne illnesses. Seniors have weaker immune systems, making them more susceptible to infections that can cause severe dehydration, diarrhea, and fever. Cooking sprouts thoroughly before consumption can eliminate these bacteria, making them safer to eat. Alternatively, seniors can get similar nutritional benefits from cooked leafy greens like spinach or kale, which provide fiber and vitamins without the same risk of bacterial contamination. If someone is determined to eat sprouts, buying them fresh, washing them thoroughly, and storing them in the refrigerator can reduce, but not eliminate, the risk of infection. Blue cheese may be delicious, but they can pose a serious health risk to seniors if they are made from unpasteurized milk. Unpasteurized dairy products can contain Listeria, a type of bacteria that can cause severe food poisoning, especially in older adults with weakened immune systems. Listeria infection can lead to symptoms like fever, muscle aches, nausea, and, in severe cases, life-threatening complications such as meningitis or sepsis. Hard cheeses like cheddar or Swiss, as well as pasteurized soft cheeses, are safer alternatives that still offer good calcium and protein content. When purchasing cheese, checking the label to ensure it's made from pasteurized milk is essential for minimizing health risks. Seniors who are cheese lovers should also practice good food safety, storing cheese properly and consuming it before its expiration date to avoid bacterial contamination. Many canned soups, vegetables, and processed foods contain excessive amounts of sodium, which can be harmful to seniors. High sodium intake contributes to high blood pressure, leading to heart disease, kidney strain, and fluid retention, which can cause swelling in the legs and feet. Since seniors are more prone to hypertension, reducing salt intake is crucial for maintaining cardiovascular health. Some canned foods also contain preservatives and additives that may cause digestive discomfort or allergic reactions. A better alternative is to choose fresh or frozen vegetables, which have lower sodium content. When canned foods are necessary, opting for low-sodium versions or rinsing them before use can help remove some of the excess salt. Cooking homemade soups with fresh ingredients allows for better control over sodium intake, making meals both healthier and more flavorful. Raw or undercooked eggs can be dangerous for seniors due to the risk of salmonella contamination, a bacteria that can cause food poisoning. Symptoms of salmonella infection include severe diarrhea, fever, and dehydration, which can be especially harmful to older adults. Seniors already have weaker immune systems, making it harder to fight off infections. Foods that commonly contain raw eggs, such as homemade mayonnaise, hollandaise sauce, Caesar salad dressing, and cookie dough, should be avoided or made with pasteurized eggs. Cooking eggs thoroughly until both the yolk and whites are firm reduces the risk of bacterial infection. For those who enjoy eggs, safer alternatives include scrambled, boiled, or poached eggs cooked at a safe temperature. Seniors should also practice proper food handling by storing eggs in the refrigerator and consuming them before their expiration date. Fried foods like French fries, fried chicken, and donuts are high in unhealthy trans fats and saturated fats, which can contribute to high cholesterol and heart disease. Additionally, fried foods are hard to digest and can cause acid reflux, a common issue among seniors. Eating a diet high in greasy foods also increases the risk of weight gain, which can put extra strain on the joints and contribute to mobility issues. Instead of frying foods, seniors can opt for healthier cooking methods like baking, grilling, or steaming. Using heart-healthy oils such as olive oil or avocado oil in moderation can also help reduce the risk of cardiovascular problems. Seniors who crave crispy textures can try air frying, which provides similar results to deep frying but with significantly less oil. Excessive sugar intake from soda, fruit juices, pastries, and candy can lead to diabetes, weight gain, and inflammation. Seniors are already at higher risk for developing type 2 diabetes, and consuming too much sugar can cause blood sugar spikes followed by crashes, leading to fatigue and dizziness. Additionally, sugar contributes to tooth decay, which can be a problem for seniors with weakened enamel. A healthier alternative is to drink water, herbal teas, or naturally flavored beverages without added sugar. Instead of refined sweets, seniors can satisfy their sweet cravings with fresh fruits, which provide fiber and essential nutrients without the negative effects of processed sugar. Alcohol can be particularly dangerous for seniors because it interacts with many medications, including those for blood pressure, pain relief, and mental health conditions. Even small amounts of alcohol can cause dizziness, increasing the risk of falls and injuries. Over time, excessive alcohol consumption can lead to liver damage, cognitive decline, and high blood pressure. While occasional moderate drinking may be safe for some seniors, it's important to consult with a doctor before consuming alcohol regularly. Safer alternatives include non-alcoholic wines, flavored sparkling water, or herbal teas. Too much caffeine from coffee, tea, or energy drinks can cause dehydration, rapid heartbeat, and insomnia. Seniors are more sensitive to caffeine because their metabolism slows with age, making it harder to process and eliminate caffeine from the body. High caffeine intake can also lead to anxiety, digestive issues, and increased blood pressure. While moderate caffeine consumption is generally safe, seniors should limit their intake, especially in the afternoon or evening, to avoid sleep disturbances. Decaffeinated coffee, herbal teas, and water with lemon or mint are great alternatives that provide hydration without the stimulating effects of caffeine. As we've seen, some everyday foods can pose hidden dangers for seniors, affecting everything from heart health to digestion and immunity. While it may be difficult to give up certain favorites, making mindful choices can help prevent serious health complications and promote overall well-being. By opting for fresh, nutrient-dense alternatives and avoiding foods high in sodium, sugar, and unhealthy fats, seniors can enjoy a balanced diet that supports their energy, mobility, and longevity. Healthy eating doesn't mean sacrificing flavor or enjoyment, it means making smarter choices that keep the body strong and resilient. Whether it's swapping processed meats for lean proteins, choosing whole foods over canned options, or moderating caffeine and alcohol intake, every small change adds up to a longer, healthier life.